Hi, I'm Naomi Wassambili and I'm the co-lead for Health Liverpool. I've been a part of and organised a range of different hackathons based here in the UK but also internationally, and last year me and Megan really wanted to bring Hacking Health to Liverpool.
We went to a hackathon in the Netherlands and we just fell in love with the idea of a hackathon, and it was a hackathon all around health, so we decided to bring it to Liverpool because we thought it's something that hasn't really been done here. Although there are lots of hackathons, they aren't specifically about health.
The hackathon put me in contact with a lot of professionals who helped me to solidify my idea, and then I managed to win a big grant from John Moores University to take that idea forward. Without my experience of the hackathon this time last year, I wouldn't have made so much progress on the project that I'm working on now.
I think it's really important to bring together a wide range of different people, and that can be clinicians, healthcare professionals, developers, entrepreneurs and patients. Often when people are thinking about solutions in healthcare, they're thinking of it in silos of their clinical group or organisational group, and actually bringing people together over a really intense period of time from different backgrounds can not only result in some really fantastic innovations in healthcare, but also provide solutions that are from a completely different perspective as to what you would find if you were ordinarily working within the NHS or within the health service.
So we've pitched some problems around dementia and the experience of dementia, so I think we'd like people to work with us in trying to solve some of those problems.
So the one we chose for the hackathon was vulnerable patients, and trying to see if we could help make them more independent. So one of the challenges we chose was fall detection, if they've fallen over in the garden or in the house, making sure that we could alert loved ones that they needed some assistance.
We've been involved today in developing Safe to Drive virtual reality app based on dementia sufferers or people with mild or minimum dementia.
Some of us know each other and we've come together yesterday and we had a few ideas, to be honest with you, but we kind of consolidated them all, and what we all felt really strongly about was the issue of self-harm. So we wanted to come up with a real practical solution to kind of support young people. So Tom's actually developed a prototype, and the thing that we invented was called Reli. It looks like a Fitbit, and what we really liked about it is it's quite sleek and it's discreet, so you wouldn't quite know whether it was a Fitbit or not really. We've actually got a project starting next week with young people who self-harm, so we're going to do a lot of research with them and develop that piece of work for ourselves as a team as well. We're going to come together really, aren't we?
I think it's been a fascinating event, and I have come across so many people from different backgrounds and fields, and it was quite interesting to see how different perspectives from different people come together and create a product.
A brilliant event for students, not only just like people myself, but various other people to bring their ideas and bring them to life, and create a strong team with various different ideas and abilities.
So Naomi from Chinua, based here in the centre city, approached us because she knew that we were a healthy food business, and given this is a healthy hackathon, she thought our catering would be perfect for the event.
So I think Hacking Health is really important because it brings people together who've got a passion to solve health problems and health inequalities, and people are doing it in their spare time, they're volunteers, and that passion really shows in the innovations that we've seen here today.